brief overview of your limbs. So now we're going to get into your appendicular skeleton. And I really like these comparisons that the book was making of the limbs. Okay, so upper and lower limbs. So they have a lot of features that are common. You have a proximal part of the limb that is supported by this girdle. Okay, upper and lower limbs. And so you have here the pectoral girdle, and you have the pelvic girdle. They'll support the appendicular skeleton. You're showing here those bones that interact with the appendicular. The proximal part of the limb has this one large bone, and then the distal part has two smaller bones. So proximal part, one large bone, distal part, two smaller bones. You have to know the names of the bones. The big bone in your arms, those are humerus. The big bone in your legs, femur. Okay, let's start with the big ones. Okay. And at the ends, you're going to have little bones that become feet or hands, right? Now, there are some common features to feet and hands. Both have 5 metacarpals, okay, or metatarsal. Metacarpal goes on your hands. Metatarsals go to your toes, okay, go to your feet, okay? Then each one of your feet and hand, they're going to have 14 phalanges. Those are the long bones of your fingers, okay? All right, your lower limb, the lower limbs, those are for weight bearing, okay? Now, in order to have a lot of weight bearing, you're going to sacrifice on motility, okay? So some motility is going to be sacrificed for you to have more stability. If you compare the joint of the humerus to the girdle, thoracic girdle, you know that you can really go through a lot of motion with your arm. You try to do that with your leg and you're in trouble, all right? What is normal is limited flexibility with your legs, but a lot of flexibility with your shoulders. And this is why it's so easy to dislocate your shoulder, right? Through some exercise or external activities, easy to dislocate your shoulder. Thank goodness it's not so easy to dislocate your leg. Imagine you have to pull the leg back into the socket. That is painful. I think it's easier to break the leg than to dislocate it, right? Because they have a lot of stability in the joint. Okay. Upper part is relatively lighter, right? And of course, lower limbs are a lot heavier. More mobile joints are less stable, and you get more frequently injured if you have more flexibility. Oh, here we go. Another one. Which of the following bones is not part of the appendicular skeleton? So you just have to remember now, appendicular is just arms and legs. See, and I did have people who said something else. Okay. Sternum is definitely not part of the appendicular skeleton. Clavicle, scapula, not spatula. Scapula, those are going to make your shoulder girdle, and then the ilium, that's going to be part of your pelvic girdle. But even if you don't know those, when you look at the sternum, and that's in the middle of your chest, that's definitely not part of your appendicular skeleton. So elimination strategy. Okay. Now, pectoral girdle and the functions, right? That is going to articulate with the trunk of the body, and of course, it's going to support your arms. And what is going to make, what is composing this girdle? You have 2 bones that you need to know, only 2, okay? Clavicles and spatula. You have to know what they look like. You have to know where they are, okay? So clavicle, you also know that as your collarbone, right? And some of us have very prominent collarbones, right? It is S-shaped type of bone, okay? And is going to extend between the sternum and the bottom part here of the scapula. Okay, do I care if you know the mandibulum and acromion? Too many weird words. What you have to know goes from sternum to scapula. That's good enough. Does that sound like a test question? Yeah, okay, cool. All right, so here again is your clavicle. Here is not really looking like the S shape, but it is, okay? So that's where it is. All right. Then you look at your scapula. That's your shoulder blade. If you try to scratch your back, you're going to feel your scapula like right there, right? And you should have enough flexibility to actually put your other arm over there and feel your scapula, right? That's your scapula. Now, a couple of important parts of this scapula, right? The shoulder blade right there is the spine. Look, there's a huge spine right there. Can't miss it, okay? And acromion right here, okay, is the bony part of the scapula, like right there, before it goes to the humerus, okay? There are a lot of parts that are interesting and some parts that are very easy to remember, like superior border. You look at this bone, it's kind of triangular shape, okay? So you have a superior border, you have a medial border that goes towards the middle of the body, and you have a lateral border that goes on the other side. Okay. Of course, this looks like a triangle, so you have a superior angle right there, inferior angle right there, and a lateral angle right here. Okay. Now, this guy here is important because it is part of this glenoid cavity right there. Why is that important? Because it's going to articulate with your humerus. That's the only part here that I'm giving more specifics about this bone, because there are a lot of places in this bone, right? There are a lot of things to know about this. Okay, so glenoid cavity that is going to connect here with your humerus. That's an important thing to know. All right, so here comes your humerus. And I do like this t-shirt. I found this humerus, right? Upper limb. Of course, you have the parts of your upper limb. That is your arm, your forearm, and your hand. Easy. Bones to know here. Let's keep them short. Humerus, radius, and ulna. And then you have your wrist and your hands. Let's clump them all together. Carpal, metacarpal phalanges. Right? So we group them all together. Carpal, metacarpal, phalanges all into one group. You gotta know where they are. Okay. So humerus, radius, and ulna. Okay. So here is your pectoral girdle. Here comes your humerus. And remember anatomical position with the thumb sticking out? This is why you gotta have the thumb sticking out, because if you put the thumb sticking in, and then you get those two inversed or confused. So thumb is sticking out. If the thumb is sticking out, the part that is to the outside is the radius. The part to the inside is the ulna. Radius, ulna. Looking at the humerus, you have the head of the humerus. Okay, that's for the articulation. Where is that going to articulate? Oh, look at that, glenoid cavity of the scapula. That's why it's important, and it's showing up in red and bold and in 2 slides. Yay! Let me put a little star here so I remember to ask a question about it. It's like my notes on it. Okay, so greater cervical. No, forget about the cervical. That's too much detail. Okay, so what else you need to know here? You have your anatomical neck of the humerus. That is right here. And then you have a surgical neck of the humerus. Okay. This surgical neck of the humerus is a part that can get broken quite often. Okay, you can imagine the anatomical neck is right at the joint. You're not going to break that, and it's very strong bone there too. Shaft of the bone. Okay. Now, what is important? These 2 bones right here, they're going to form your elbow. Right, so you have humerus, radius, and ulna is going to form your elbow joint. When you look at, let me see, protuberances or parts that stick out of the humerus, you're going to find this medial, you call also epicondyle, okay, or lateral epicondyle, okay, medial coming to the body, you feel the bone right there is your humerus, and lateral going to the outside. You can't feel that because it's kind of flat. Looking at your forearm, again, you have your radius and ulna, okay? Those are parallel bones, and they are very importantly kept together by this tissue, by this very dense connective tissue, okay, that gives it stability. What you need to know is this interosseous border. There is the part that is to the inside of the bone, okay, between here, the dense connective tissue. This is the border for the bone, interosseous border. And then you have this interosseous membrane. This is what gives stability and flexibility to your bone. It's also considered a type of joint. Okay. Now, when you look at your humerus, you're going to see that the connection with your elbow is a very round type of joint. You call that the olecranon fossa, okay, an olecranon process. That's the other name for, for your elbow joint. This joint, as we're going to see later when you get into joints, is considered synovial fluid joint. It's the most flexible type of joint. And you see there are some membranes that go around this joint, and there are even some membranes that go the outside and form little pockets. They are called bursa. Okay, and if you also play some types of sports that use your elbows a lot, you're going to find that some of these membranes can get inflamed, and that's what you call bursitis. Just because I saw the bursa here, remember that. All right, so here, as I mentioned, interosseous borders, and then you have this interosseous membranes. Okay, dense, regular connective tissue. Okay, what is the use? Keeps them a fixed distance apart and also allows for movement, for rotation of the arm. Okay, position. Supination. You hold the cup of soup, and that's supination. Pronation. That's when you have the radius that go over the ulna, and you just drop the soup, and that's the pronation. Okay, supination, soup up. Okay, now remember what happens when you go to pronation, the bone crosses over. Which bone? Radius. All right. These guys here are your carpals. These here in the middle, in the palm of your hand, are your metacarpals, and your fingers are phalanges. One important thing you have to know about the fingers: your thumb. How many phalanges in your thumb? 2. Everybody else has? 3. Okay. Last slide. Carpal tunnel syndrome. If you're always in the computer using your mouse, sometimes you develop irritation in a nerve, and that is carpal tunnel. Painful, okay? And there are solutions for that. But if you ever hear a carpal tunnel, that has to do with inflammation of your hand. Talking about the pelvis. Just wrapping up on chapter 7. Okay. So here you have your pelvis, right? This is the pelvis, and it's really made up of 4 bones. So you're going to have the sacrum right there. That's at the bottom of your spinal column, right? You have coccyx, which is the bottom here. Remember the tailbone? The coccyx? All right. And then you have 2 of these huge bones right there. That is your ossa coxa, or they're also known as your hip bones. Okay, so 2 hip bones, and then you have sacrum and coccyx. Okay, now what's the use of the pelvis? It's going to support your guts, and is going to mainly shift the weight of the rest of your body into your legs. Okay, because your femur is going to be connected to your hip bones, right? Femurs to hip bones. Okay. Now, when you look at the pelvic girdle, that is only made up of two bones. Okay, only the hip bones. So this hip bone and that hip bone. That's your hip girdle. And what is the girdle used for? That is going to articulate with the axial skeleton. So girdle articulates with the skeleton, and same thing went for your pectoral girdle. That is going to articulate with your axial skeleton. Okay. All right, so here is your hip bone. What is making up that hip bone? So this is missing the rest of the word here. Ossa coxa is really made up of three bones that fuse together. And here you don't see the fusion of those bones, which happens like right there. But next slide, I did put a picture of those tutorial videos that have nicely color-coded different bones, and those are really easy to identify, right? We're going to do a little exercise on identifying the bones of your hip bones here. Okay, so what are the three bones that you absolutely have to know? You have the big one, that's the ilium, right? And this one you go through exercises. If you put your hands on your hips and you feel that bone, okay, so everybody can feel your hips, feel the bone. That is your ilium. Then you're gonna have, what else? The ischium, that's the bone you're sitting on. That makes your butt bone, like right there. You don't have to feel the bone. It's just, you know it's there, right? And then you have the other one. Which one is the other one? The pubis, which in the front too, yeah, definitely don't feel that bone right now. You can feel them, right? I mean, when you are in your own private setting, go ahead and feel those bones. If you have a lot of cushion around your ischium, you're not going to feel that one very well. But if you have a very skinny bottom, then you might be able to feel a bony ischium, okay? So what is that? Ischium, and then you have the, what is the one on top? Pubis, around your pubic area, you're going to feel that bone. And then you have your ilium. Three bones. Everybody cool? All right. What else is important here? Important thing here. You have here this indentation here that is called the acetabulum. Okay, acetabulum. This is where those three bones fuse. Okay, they fuse at that point, at the acetabulum. And here is going to be the socket that is going to articulate with the femur. So that is one important thing to know. I am going to make a little note on thing to know. When you see a little star, what does that mean?
It's going to be on the test.
It's going to be on the test. I'm going to ask you about it. That's a good test question, right? Okay, so acetabulum, that means the socket, ball and socket type of joint with your femur. And when you look at the acetabulum, you're also going to see this type of cartilage that protects that socket that is called the lunate surface because it looks like the moon. But that's a bit of too much detail. But just in case, you know, if you look at that and you say, oh, lunate what? Oh, it just looks like the moon. Somebody just named the moon type of shape surface. Okay. All right, so here we'll look at the ischium, which is at the back part, right? So this is your vertebral column, and ischium, that's your butt bone, okay? What is very characteristic of this, it has this triangle type of spine, which is right there, okay? The triangle right there, type of spine. And then it has like ischiotuberosity, and this here is the formal name, the more delicate name for your butt bone. It's ischiotuberosity. Okay, so it's also called sits bones, or also called butt bones, right? So why is that important? Well, it's going to hold the weight of the body when you are in a sitting position. All right. Okay, so here is your triangular ischial spine, and that's your ischiotuberosity. Okay, pubis, right there. So two on this side, on the other side. And this is a picture that I told you from the tutorial video that shows the fusion of those three bones, right? You got to know what they are. Okay. So where do they fuse? At the acetabulum. That's the socket. Okay. One thing that is really outstanding with these bones is that you have this huge hole right there, but of course you don't call a hole, we call that a foramen, right? So this is a foramen. So that is where some very important muscles pass through, like this obturator muscle. That's a muscle that is very important, that is going to lift your leg. Okay, that's the muscle that goes through that foramen. Okay, so here is just extra exercise for you to name the features. Okay. And we didn't mention about here, which I will mention on joints. This is your, what is the name of that? Pubic symphysis is a joint actually, right? We're going to see that in the next chapter. The bone that articulates with the acetabulum, okay, everybody has to get this one right. Hey, that's your femur. All right, differences between the males and females, okay? It should be very obvious, because if you have a very narrow opening here at the pelvic inlet, that is not a very comfortable place for a baby to go through, so that must be the pelvis of a male. And then you look at this, it's like, okay, that's a bit more comfortable for a big head to go through. So that must be a female. That's one of the main differences, the shape of the pelvic inlet. Another difference is the angle of the pubic arch. So this thing is a pubic arch, close to the pubic symphysis. In females, this angle is more obtuse, right? In males, this is more acute. Okay, so smaller angle in males, larger angle in females. And just the general appearance. When you look at male pelvis, it should remind you of a heart shape, right? When you look at female pelvis, it's not such an obvious heart. I think of this more of a butterfly shape, kind of, right? So heart shape is the male pelvis. You look at it and you say, oh, it's kind of narrow, and that opening is not very big, very acute angle at the pubic arch. That's a male. Can you differentiate between male and female? Yes, okay. All right, so legs of the lower limb, the minimum amount of details possible, okay? So what do we have here? You have the femur, you have the patella, which is not showing there, but it should be like right there in the middle. So let's draw the patella right there. Okay, remember patella is a sesamoid bone, right? You're not born with it. So you have femur, the patella, you have tibia and fibula, and then you go to your feet, okay? So you're going to have your tarsal bones, metatarsals, and phalanges, and those are very similar to the ones you find in your hands, I've seen before, right? Now, you have to know the femur is connected to the tibia, right? And the fibula is not part of the joint. Okay, so that's one of the differences between the leg and the arm. Okay, because in the arm you have connection of the three bones at the joint, at the elbow, but when you look at your knee, you only have femur and tibia. You see, those names are confusing. If I'm getting them confused, most likely a lot of people will too, right? Femur and tibia. Tibia is the bigger one, is the weight-bearing bone of your lower leg, right? Everybody got to get this one right. Okay. Fibula is the one that is more lateral, right? So the name is telling you fibula for lateral, okay? So that's the one that is thin and is not really bearing the most weight of the body. Okay, so this is also for your exercise, straight from that supplemental video that comes with the book. So what's happening here? Exercise, just get to know the details that you need to. So the femur, if is the strongest and the largest bone in your body, right? The head has this round ball, well, round head, well, it should be a ball here. Okay, so this round, oh, that's so redundant. Of course, the ball is going to be round, right? I mean, it's this thing that goes into the socket. What is the socket? The acetabulum is the socket. What is a patella? That's your sesamoid bone, and now it's showing here. Okay, it's a sesamoid bone, and that is your kneecap. Okay, and remember that is in connective tissue. It's not stuck to other bones, right? It's floating in the connective tissue. Okay. Then you have the tibia, and color-coded here too is the medial bone that is closer to the center of the body. And that is the one with the knee joint. And then you have the fibula, that is the smaller one. And here is a mnemonic that was also in this study guide, saying tibia is tough and fibula is fine, is the skinny one on the side. So that could also help you to remember which one is which. A bone that lies parallel and lateral to the tibia, that's your fibula. All right, so briefly looking at the feet, you have your tarsals, your metatarsals, it's the body of the foot, of the feet, right? And then you have the phalanges, and those are your toes. All right, little bit more on the tibia and fibula. Okay, those are connected by this type of connective tissue that is dense and is irregular. So this tissue is interosseous membrane. Where else have you seen that?
Between the arm radius.
Yeah, in your arms, right? So those are the interosseous membranes that is really important for the stabilization of these bones and gives a little bit of movement, not as much as the ones that you see in your arms, okay? And again, we have here the interosseous borders. And again, this is important for a bit of pivoting and minimal rotation of the bones of your lower leg.